Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we are doing our Q&A episode. So as always, I'm joined by Maria, my trusty producer, and we're going to be reading out your questions that you have submitted on social media. Pay attention, listen up, maybe your name will be called out, and then that way you'll get a shout out and you'll get your question answered. So, Maria.
Before we start,
what do you got for me?
We got a couple of comments on our podcast.
Hold on. Are they positive?
Of course they're positive.
Well, I don't know. Maybe you want to read some negative comment. I don't want to hear.
No,
I don't want to hear any negative shit.
We have not gotten any negative comments. Okay, so.
Okay, good. That's good. That's good to hear. I love that we're deleting all the negative.
No, we're not. We can't. We don't have access to do that.
All right. What do you got? What are people?
My sister and I, our meeting with Dr. Rahban was awesome. He is very personable. I continued. Oh, wait. Let me start with, it's referring to a meeting with Dr. Rahban, and it was left by Lena 2023.
Lena 2023, we appreciate you and we love you for writing something positive. What did she say?
Okay, my sister and I meeting with Dr. Rahban was awesome. He's very personable. I continue to listen to his podcasts on all different subjects. Now that I am an informed person regarding different surgeries, I can make an informed decision. Then she goes on to say, let me see where is. Thank you and your staff for a wonderful experience and share your knowledge with us to make sure that we understand the seriousness of any time of surgery. I continue to enjoy the podcast because they are straightforward, which is imperative when making such an important decision. Marlena.
Great. I love that. I appreciate that. Yeah. You know, at the end of the day, it's your and my time, private time that we do this. So if people enjoy it, it makes you want to take your personal time and dedicate it. If people don't enjoy it, well, then we got better things to do. So that's awesome.
The next one comes from Sarah Reachling.
Okay.
And it says, I'm a patient of Dr. Rahban. What you hear on the podcast is what you get. He has told me no more than yes. No, don't touch your nose. The improvement isn't worth the trouble. No, you aren't ready for a facelift yet. No, you don't need more filler there. He's ethical and straightforward, and I really appreciate his approach to setting expectations, outlining risks versus benefits, and cutting through the nonsense with logic. Thanks for the podcast. I enjoy and learn from every episode.
Oh,
yes.
Yeah. That's not very good for building business, but I actually love Sarah. She's a lovely lady. I actually know who she is and her husband, and they have a beautiful child. And that's our job. Our job is to do what you do for your children. Doctors need to do for their patients. You have to guide them. You need to do what's in their best interest, not in your best interest. And unfortunately, it's not happening as much as it ought to, but I can't worry about anybody else. I can only worry about myself. So, well, that's lovely to hear. Thank you for sharing that, Maria. All right, let's dive into the questions. What do you got?
We're going to start with the area of the breast. You know that.
All right, breast questions. Here are the best breast questions. Say that to me.
Yeah. Okay, this comes from SG Valley Girl.
SG Valley Girl, here's your question.
I want my implants removed. What do you suggest?
Okay, so this is a massively important question. That's why I'm glad that it's first. So, every era has its trends, its things that are getting done, right? So 80s, 90s, breast augmentations were huge. They're still huge. But now, very more recently, removal of breast implants is becoming a very popular or common procedure. The reason it's becoming popular or common is there is a entity called BII, breast implant illness. It is an incredibly open-ended and vague term and a vague diagnosis because I suspect we're kind of early in the diagnosis, meaning we're not exactly quite sure what it is yet. But essentially what it is that there are individuals, and I will tell you they are real, but I also will tell you they are rare. So real and rare, there are individuals in whom their body's reaction to their breast implant, which is a foreign material, is one that is less than ideal for their body. So their body sees their breast implant like the pacemaker, like the prosthetic knee, like the heart valve, and it begins to try to manage it, deal with it. figure it out, try to protect you from it. And it consumes a ton of their body's energy, and it leads to symptoms like brain fog, memory loss, achy joints, pain, fatigue, all of which are kind of general and constitutional, meaning it isn't like I've gone blind. The reason why this has taken so long, it's probably been around for years, is, it's a small subset of people. And as a result, initially it was like, oh, these people are all crazy. They're all histrionic. But they're not histrionic. The problem is a lot of women that are getting kind of swept into this current perhaps may not have the BII. And just because you have the symptoms I mentioned, it may very well not be your implant. So caution to you, because I've had many patients recently come to me asking for their implants out. And I would still say, while some of them feel better as a result of their implants being removed, a lot of them don't. So
there's not a diagnosis that you have.
Not yet. I suspect in the next 10 to 15 years, we'll be able to test people and say you're more prone to a sensitive reaction to an implant. I don't think it's the breast implant. I don't think it's the breast implant, but you'll do well with my wife's hardware in her back is an implant, and she did shitty with it. So I don't think it's an breast implant thing. I think it's it.
Those symptoms are, look, I'm going through menopause, brain fatigue, foggy memory, fatigue, that's part of.
So that is exactly why this is a little bit of a treacherous road. What I always tell patients is before you go down this road, make sure you have crossed off the more common things: thyroid, hormones, vitamins, stress, etc. And if the last conclusion is, listen, I feel like shit, I want my implants out, no problem. Now, what is the caveat? The caveat is once you remove the breast implant, you gotta be ready. What do you got to be ready with? Well, you're removing an implant. And if you have a decent amount of your own breast tissue, which most patients don't, that's why they got the breast arc, then you might be able to reconstruct it without an implant and make a decent looking breast. Notice how I use the word decent looking?
Yes.
But if you started out with not a lot of breast tissue, and you had your implants in multiple years, and you've lost breast tissue, which is the case with most women over time, and you remove this breast implant, you should be prepared for a less than ideal cosmetic result. Any surgeon telling you otherwise is lying to you. Now, my sister had a double mastectomy. Why? Because she had breast cancer. And she doesn't give a shit about her cosmetic result as it is in comparison to survival. So if you take out your breast implants and you feel amazing and your cosmetic result is less than ideal, oh well, so what? But I caution you, because I have had several patients remove their implants. I cautioned them because I felt they didn't have a lot of breast tissue. They did it anyway. Their symptoms were not as a result of their breast implants. Their aesthetic outcome was not good at all. And now they want their implants back, and it will never look the way it did when I took it out.
Why is that?
Because it's contracted and the space is closed, and now they want the implant and the capsule out, so there's no space there anymore. It's very complicated. So to answer your question, which is a very good one because it's super apropos, when you remove a breast implant for breast implant illness, you have to be careful that you are okay with the outcome. Now, what are people doing in exchange? Oh, well, it's no big deal, right? Because you take out the implant and then I'm going to put fat in my breast. So I'm going to take out a 300cc implant times 2, and I'm going to liposuction the shit out of my body. We just did an episode with people who had liposuction, and I'm going to put that fat in my breast. And these are the things that are going to happen, guaranteed. 1, the amount of fat that your breast takes in general is a lot more underwhelming than you had anticipated. Meaning you put all that fat in and a lot of it doesn't stay, or it isn't as much as you thought. 2, because you need a lot of fat because you've removed an implant, your surgeon will be absolutely aggressive in liposuctioning you. arms, legs, thighs, back, whatever, and you will 100% have sequelae from that liposuction a year later. I've had tons of patients who have had fat transfer to their butt and their breasts and have had a shit ton of problems with the lipo. Again, choose your poison. If the result of it is that you feel better, all worth it. But that's what you need to know. There are a lot of doctors jumping on this bandwagon. Oh my God, they've made it their career. It's like a reinvention. They were like dying plastic surgeons, and all of a sudden, the BII train came by, and they've now made it their specialty, and they removed breast implants and capsulectomies, and listen, all the power to them.
Okay, so this next question comes from Aphrodite.
Aphrodite. I like that. That's cool.
Recovery time after breast lift. What is it?
So recovery time after breast lift is the same recovery time after every surgery that I do. Every surgery I do has the same recovery. 1 week to 2 weeks off work. In the breast lift cases, it's 1 week. Tummy tuck cases is 2 weeks, but it's 1 to 2 weeks. And 6 weeks before you go back to playing tennis and racquetball and jogging and exercise. 1 to 2 weeks from work, 6 weeks before we resume activity. Everybody is like that. Now, in regards to discomfort and pain and feeling unpleasantries, breast lifts, breast reductions have little discomfort. Breast augmentations, tummy tucks, and lipo have more discomfort. So one thing about not having an implant, if you don't need it, is that your pain will be significantly less because there's no muscle involved.
Can I ask you something with this, the whole pandemic thing, people working from their home? So what if someone gets a breast procedure, right? And they have to rest at home. Can they work on a computer?
Yes. So I tell patients 1 week to resume in front of people, 48 hours to be back on a computer. You literally can get back on a computer in 48 hours and just...
So typing on the computer doesn't affect
Not at all. And you can do Zoom meetings and you can do everything. Nobody would know the difference.
That's good advice for me.
Yes. There you have it. Maria constantly trying to get questions for her own goddamn procedure.
Exactly. Okay. Next is from Kristen H4.
Kristen H4.
Which we kind of touched upon now a little bit. Alternatives to implant for small-chested, thin women. Chances of BII.
So there's two questions that are completely different from each other. So what are the alternatives? It's breast implants or fat transfer. The end. I am not a big fan of fat transfer, large volume to any area on the body, breast or butt. I've now had this post 500 times. Large volumes borrowed from other areas lead to damage at other areas. The end. So if you're looking for very modest cup size improvement, I'm a full A and I want to be a B, you can do fat transfer. But I really think that unfortunately, at this time, the breast augmentation, breast implant route is by far the most consistent, reproducible, and effective way to get a fullness, whether it's a small augmentation or a large one. People don't, I don't want a big augmentation. Okay, yeah, for small implants. You just won't get the same outcome with fat, in my opinion. BII has nothing to do with fat transfer. BII has to do with breast implants in general, and as I had said in the questions previous, while it is a real entity, it is arguably a very rare entity. But on Facebook and Instagram and in very high socioeconomic areas, it's much more common, right? It's a more common rich person's disease because people are sitting around talking and there's a sense of it within groups. So your risk of it is small, but still possible.
Well, this question is from Ismo Triple I.
Ismo Triple I? Okay.
Yes, I. This we kind of responded, but I wanted to bring up something about the fat absorption. So I would like to know if fat transfer to the breast is safe and how are the results for someone wanting a little volume?
Okay, so number one, I literally had, I was in a conference yesterday. I was giving a lecture. The guy that followed me was fat transfer to the breast. That was his talk. So I literally had this conversation yesterday. Safety, it's safe. They've done many, many studies for 20 years that it doesn't obscure, complicate, or make breast cancer detection any different. Mammography, MRI, we've passed that. We know that. Second, it is absolutely only good for a modest improvement. So if you are a small B and you want to be a full B, I think a half a cup, you can get it done. Full cup, you're pushing it. Now, the issue at hand is not the breast. It's where you get the fat to put in the breast. That's what I keep reiterating. There is no free lunch. If you want Peter to be rich, you have to steal from Paul. Paul has to be poor for Peter to be rich.
But let's say if you have a little fat in your flank area, you say that area is...
Yes, but that's... Yeah, so I don't mind liposuctioning a little bit of the flank. That's not going to create... You need about 200 to 400 cc's in each breast of pure fat, not liposuction.
Right.
Pure fat. That's a decent amount of fat. You're not going to get that out of a love handle.
Now, can I ask you something? Will that person that gets a small enhancement from the fat transfer have to do it down the road? Will that fat disappear or absorb?
Whatever fat stays and whatever fat absorbs tends to stay with them. So if whatever you lose immediately within 3 to 6 months. Whatever stays tends to stay, such that when you gain weight, your breasts will get larger because the fat you borrowed was from areas that get larger. Like if you tend to get very heavy in your thighs and you take fat out of your thighs and you put it in your breasts and then you gain 15 pounds, well, your breasts will get bigger.
Got it. Okay, so I think we answered all the breast questions. Let's go for a break. When we come back, we have a question on protruding ears, pinning, and tummy tucks. So,
all right, from ears to bellies. Here we go. All right, guys, we're going to take a quick break. We'll be back for the second half of Plastic Surgery Uncensored to answer more of your questions. Welcome back to the second half of Plastic Surgery Uncensored. We're doing our Q&A session, answering your questions that you guys sent in. So if you're listening and you're like, God, these questions are so boring, that's your fault. You didn't ask any. So, Maria, what's the next question? What do you got?
Okay. The first question we have here is from Nad. I'm going to spell this out. NADZLABZ.
I'm not going to even bother to say that.
Yeah.
Okay, gotcha.
So, pinning of protruding ears. I'm 28 and want to have it done, but I'm so scared. Process, risk factors, results.
So I can't give you an entire otoplasty consult here because it requires its own session. And we have a podcast on otoplasty. So if you're interested in that particular A to Z of otoplasty, you want to check it out. But otoplasty is an incredibly effective procedure. People know that I go off and nuts on liposuction because I think it's a shitty procedure, because I don't think a really good surgeon is different than a shitty surgeon. But otoplasty, you should get a great result. Patients are happy. It's skillfully done. The results last a lifetime. It's pretty straightforward. It shouldn't take more than 2 hours to do. The only real risk with ear pinning is usually overpinning. That means that the guy or gal, whoever does your ear, just like slams your ears to your head and just glues them to the back of your head. And then, of course, it doesn't look natural. Otherwise, I want to say that it's pretty straightforward. I would have to say that I don't remember the last time that I did an ear pinning and didn't have a happy patient. It's pretty successful. And I think if you are interested and you're nervous, it just means you haven't done enough homework. You should be able to overcome your fear by finding someone who you think will do a good job.
Now, if that happens to someone that they overpinned it or whatever, can that be fixed?
Very hard.
Oh.
You can always pin more. It's very hard to unpin.
Yeah, I think in one of your episodes, a doctor said it's always better to do a little less than to go overboard.
Well, I mean, the answer is we can always add Botox. We can always cut out skin. We can always remove fat. We cannot add that stuff back with great ease.
Okay. Okay, next one is about the chin. From Kelly Alex 1024.
Kelly Alex 1024, here's your question.
Yes. What kind of procedures are there for removing loose skin in double chin area after weight loss?
Okay, so the question is, what can we do about the skin underneath your chin once you've lost weight? Listen carefully. You need a facelift. That's it. That's the answer. You got it. There's no skin tightening machines. There's no Kybella, all therapy, this, that, the other. You have loose skin. It needs to be cut out. The only way to remove it is through a facelift. Wait, but I just said it's in my neck. Yes, a facelift and a neck lift and a mini facelift are all the same caca. Just different names. All the skin in your neck is removed through your face. You remove the skin of your neck up and out through in front of your ear. So it's kind of a misnomer. Facelifts address jaw lines, and your neck is part of the jawline. So it doesn't matter if you're 35, if you've lost 100 pounds and you have loose skin in your neck, and it doesn't matter if you're 45 or 55, the answer is still a facelift. And the result is spectacular because you've lost the weight. And now it's just a matter of removing the loose skin. Anytime in plastic surgery, we're dealing with loose skin and it's done appropriately, eyelids, neck skin, arm skin, belly skin, breast skin, we tend to do quite well with the results.
Okay, the next one is about tummy tucks. Francesca_Jamil.
Francesca_Jamil, what's your question?
Is rebuilding the abdominal wall always part of a tummy tuck?
So I think what you're referring to is rebuilding the abdominal wall is repairing the muscle separation, also known as diastasis recti. So your question is, do you always have to repair the muscles during a tummy tuck? And the answer is no. I just did a tummy tuck 2 weeks ago on a family friend who had lost a bunch of weight, young girl, never had kids. Her muscles were rock star, thick and strong and together, but she had a lot of loose skin. She needed a full tummy tuck because of the skin portion. The muscle part has to do with muscle separation, which happens as a result of having children. It doesn't happen as a result of being overweight. It happens as a result of having a 5, 6, 7, 8, 10-pound child push inside of your abdomen for 9 months repetitively, meaning 2 or 3 or 4 kids. So if you didn't do that, yet you have the skin portion, then you don't need the muscle portion. Vice versa. You might need the muscle part and not have any loose skin. You still need the tummy tuck to do it.
Got it. Next one is from Kristen H4.
Christian H4.
Top recovery tips for tummy tucks.
Top recovery tips for tummy tucks. Listen, tummy tucks are one of those procedures that have a terrible rap. You say tummy tuck to a woman and immediately it's like, oh, the pain is going to be unbearable. I'm going to be hunched over. I'm going to be in misery for months. It's a lie. Does that happen? Sure. Should that happen? No. So what I'm going to tell you is the recovery of my patients. The reason why I say that is there is a lot of delta out there, meaning there's a big difference in way people recover based on how the surgeon does it. I would say the overwhelming majority of stories are of unhappy, miserable people who are in a shit ton of pain. We have had 10 episodes about tummy tucks. One of them was specifically about pain as it compares to a C-section. And the lady who was like, had multiple C-section was like, it doesn't even compare, it's so much less. So pain is usually a week of moderate discomfort. Let's say
she said it was the tummy tuck was less painful than
C-section.
C-section.
Remember the episode we had? Yeah, of course.
Yeah.
Because in a tummy tuck, you're not separating the muscles, going into the abdominal wall, cutting open the uterus, ripping out a child, sewing everything back together. And oh, by the way, while you're recovering, you got to carry a child around and breastfeed. And no one gives a shit that happened to you. Yeah. It's all about the baby. On a tummy tuck, we stay above the abdominal wall, and you get to lay down and rest. You can't even compare the two. So, pain-wise, it's usually a week. You're out of commission for 2 weeks. You can work on your computer usually around 2 to 3 days, and you can expect to be starting your exercise, bicycle, lifting weights at 6 weeks. You're going to notice my recoveries, doesn't matter if you had a rhinoplasty or a mommy makeover, they're all going to be 1 to 2 weeks of immediate recovery, followed by a total of 6 weeks before you can resume activity. In my practice, patients don't need walkers. They don't buy all kinds of special beds. They don't need any kind of gimmicks or nonsense. Anything and everything you need, you get from us. And otherwise, it should be a pretty straightforward recovery.
I had a C-section and I didn't feel hardly anything. I mean, I was a week, like you said, and I was back to walking like if nothing. Hair affair by Niaz.
Hair fair by Niaz?
Yes.
Okay.
Well, okay. I know what you're going to say about this. What is a mini tummy tuck, and how is it decided if one needs a full or mini?
So mini tummy tuck is decided if you have the money or not for... No, I'm just kidding. I can't afford the full one. Can you give me half of one? So there is only one indication for a mini tuck. Only one indication for a mini tuck. Only one. You have 0 loose skin above your belly button. None. The skin above your belly button looks awesome. You have no muscle bulge at all. So the question is, then what the hell do you have? You have loose, redundant, crepey skin underneath your belly button that is around the C-section area level, loose, wrinkly. You're otherwise flat, and you're otherwise look great above. Then a mini tummy tuck where we remove skin is a great idea. Otherwise, you need a full tuck, irregardless of any presentation you mentioned to me.
Okay, next one comes from Mary Jo 81.
Mary Jo 81, what's your question?
How much weight loss do you recommend before surgery, below maintenance or above?
So I think the question is, how much weight loss do I require below or above your ideal weight? So this is an interesting question. So it has 2 parts to it. There's what I wish and there's what will happen. In the ideal world, which we don't live in the ideal world, but in the ideal world, you want to be at your ideal weight or the weight that you are likely to stay and be happy. So the fact that when you were 24, you weighed 126 pounds, and now 4 kids later, you're 147, you are not going to get most people back to 126 or whatever you were. That's not realistic. You're a mom of 4 kids now, your body has changed. What you don't want to be is overweight, heavy set, intra-abdominal fat, and then come get a tummy tuck. What you don't want to do is be overweight and get a breast reduction and then get inspired and lose 20, 30 pounds. Body surgeries and face surgeries are very sensitive to your weight. You know what your face looks like. You know what your body looks like. 20 pounds heavier, 20 pounds skinnier. So the last thing on earth you want to do is find someone, pay them a shit ton of money, have them do something on you that's permanent, and then gain and lose a ton of weight. So we want you to be as close to your ideal weight as you can get so that when I do or when we do the surgery, you're set, you're locked in, you're good to go. So whatever that is, it's totally up to what you can do. I think that most people can do better than they say they do. I think that people don't have the determination and the discipline to get where they need to go, and they just kind of want to just fucking throw in the towel and do the surgery. Not ideal.
Yeah, and also you have to focus so much harder to lose weight.
Oh,
that. Yeah. When I'm in stress, I can't do any type of diet. When I'm not stressing, I can kind of focus on it.
I know, but all patients want to look the bomb.
Yeah.
Everyone comes in and says, Dr. Rahban, I want to look amazing. And then all I ask you to do is lose a little weight and I'll do the rest. And you don't even want to do that. So what can I tell you?
Okay, next one, it's about combination surgery. This one comes from Chelly Avila.
Say again, what's the name?
Chelly Avila.
Chelly Avila. Here's your question, darling.
Would you ever do a rhinoplasty at the same time as a breast augmentation?
The answer is absolutely. I do breast augs and rhinos all the time. I do what's called combination surgery predominantly. I predominantly do multiple surgeries. So listen, there's this very, very wrong notion that your body can't handle it. Like somehow your body's going to like run out of energy to heal. That's not true. The only thing that happens when you had a recovery is that it's inconvenient. Time off work, time off school. You have to get people to help you, your kids. It's an inconvenient time, right? So we want to do it as few times as possible. Do you want to do your breast? Recover, take off work, take off school, take off exercise, take, get better, feel amazing, and then come back and do it again for your nose? Why the hell would you want to do that? That's why we do a breast lift, breast aug, tummy tuck, lipo in one session. That's why we do your brow, eyelids, facelift, fat transfer in one setting. That's why we do these combination surgeries. Obviously, it's got to be done safely. Obviously, there are limits. But in general, if you can do it, meaning your surgeon can do it safely, you should try to combine surgeries and get it over with. Perfect.
Okay. Next one is wifeystatus.co.
Wifeystatus.co?
Yep. Botox. How to use it for an eyebrow lift. Also, why sometimes does it make brows drop?
That's actually an excellent question and a very good observation. So let's go through this. What is Botox? Botox is a neuromodulator, means it modulates, alters nerves, meaning muscles. So it's a neurotoxin that when you inject it into a muscle, it makes that muscle temporarily paralyzed. Again, I inject Botox into a muscle and it stops working. And then after 4 or 5 months, it comes back fully the same way it was before I injected you. Agreed? Agreed. So when you inject Botox into the forehead, you paralyze the frontalis muscle. That's the muscle that wrinkles your forehead. So you don't get wrinkles. So far, you following?
Yep.
When you paralyze the forehead, it relaxes. When it relaxes, what happens to the structures that it was holding up? They settle. So Botox done in the forehead aggressively and heavily will 100% of the times drop your eyebrows because your muscle in your forehead is lifting your eyebrows. That's why you wrinkle your forehead. Go ahead, Maria. Lift up your eyebrows. Holy shit, what are all those wrinkles? So if you can't wrinkle, means you can't move, which means the muscle is relaxed, which means your brows are low. Now, the reason why we can do it is it's about the amount of it we use and where we use it. So if you plaster the forehead with Botox, you will cause it to be so knocked out that it relaxes and you get droopy eyelids, eyebrows. If, however, you only inject it in the middle of the forehead and you don't inject it on the sides of the eyebrow, on the sides of the forehead, so think about it. The middle doesn't move, the sides move. Then your brow will not move in the middle and lift up on the sides, and that's when you get a brow lift. You don't get a brow lift from injecting Botox. You get a brow lift from not injecting Botox. If that doesn't make sense, I can't help you because that's as clear as day.
I have a friend whose one eyebrow is always sticking up like this, and she was like,
She has a shitty Botoxer.
Yeah, that's what I thought it was. Well, that's it.
That's all? Okay, that's pretty cool.
That's it.
Well, all right. All right.
Very informative. I love this segment. I always do. I know
Maria wants me to make the entire podcast Q&As, folks. If it was up to Maria, every goddamn episode would be Q&As. Everything is about Maria because she finds it interesting and learns.
I'm curious. I'm curious about
Curious
I'm
George.
sure there are other people that are just as curious as I am.
All right. Well, I hope that you guys enjoyed it as much as Maria did. I hope you find it educational and informative. As always, if you have questions when we prompt you on social media, where Dr. Dr. Rady, Rady, Rahban, Rahban. If you're not following me, shame on you. Follow me. And on TikTok, I don't even know what our TikTok is, but nonetheless, if you follow us on those social media platforms, we will prompt you to ask questions that we will answer on the show. So make sure to follow us. Make sure to pay attention. As always, if you love our show, please share it with people you care about. You never know when they're going to do something you didn't know they wanted to do, and you will have wished that you had told them the information you guys are learning here. And last but not least, I always beg you guys for good reviews. It makes me happy. We sit here, Maria and I, we bust our ass on our private time so you guys can learn some stuff. You enjoy our show.
It's not us. You have a whole team behind you. You have Renee, you have Sally.
True.
Office manager, which we had an episode with Sally.
Very true. So we all bust our asses for hopefully your benefit. So if you do indeed enjoy the show, we are always so happy when you write nice stuff. It always makes people feel good. Go share something positive so that we can keep on chugging. All right, guys. Well, that's another episode and another wrap. Until next week, signing off, Dr. Rady Rahban on Plastic Surgery Uncensored.
Bye.
Bye-bye.